Hello, everyone. Good evening. Hi, it's Tuesday and it's 10 p.m. exactly. Welcome to our Facebook Live. This is our session again for 2022. So, before anything else, let me introduce myself. My name is Mr. Alan Matus, and I have been an educator for more than 20 something years. And I have been teaching NCLEX. I'm an NCLEX specialist, a nurse educator, and at this time, I'm also a nursing faculty for a nursing program in Los Angeles, California. And also, I'm an author of a book that I published in Amazon. And of course, you can get this also from Barnes& and Noble, Walmart, or any other bookstore out there, online bookstore. So this is the name of my book, everyone. It's called the Simple, Fast, and Easy NCLEX Review that you can purchase in Amazon. It's also available in the Philippines, and you can just send us an email to find out how to order in the Philippines. So this is available in Amazon, and it has a very good rating, of course. So that's my book, guys. Okay, so welcome everybody here. And before anything else, again, too, I would like to give a shout out to the following people who came in here early tonight. Okay, so who are the earliest people who came in tonight, guys? So the earliest is Chinyeri Ogochokuo. Okay, so I'm giving you a shout out. You're gonna be in YouTube also. We have Garcia Lean Tin Caliao from Abu Dhabi. We have Alfred Sat Asuncion from the Philippines. Lisel and Kraft. I think she's my classmate. Reka Bandari Mejura, and then also Vibrant Diane Rose, one of our pastors for the RN. Charles Ewad, Joyce Jamila Flores is from KSA or Saudi Arabia. Jason Rancapero. We also have Churita Mama. Okay, so we have Gian Torres, Marcy Nomra, MJ. Hi, MJ. Hi, how are you? Also, we have Gian from KSA. Also, Jazz Gerlos, my student, and Joe Balsky, also my student. So welcome to the Matus tribe, everybody. Okay, so there's a lot of you. I'm gonna give the others later on a shout out. Also to Nora Cornelson. Hopefully you're doing very well tonight too. Okay, so now let's share. Without further ado, let's share our first slide for tonight. Okay, so our tonight's session will be again about delegation and prioritization. So I would like to find out if you can guess what is the focus for tonight's discussion. Okay, the focus of tonight's discussion. I will let you guess tonight. Okay, so but anyway, we have the Yan Rose. So the Yan Rose passed the NCLEX actually recently. So she says in her testimonial, "Do not let your failure stop you from reaching your dream. I am a repeat test taker." I don't think it's ninth time. I think it's only several times. So she's a foreign nurse graduate way back in 2007. I was one of the winners of Sir Alan's Self-Study Comprehensive Online NCLEX Academy last April 2021. Then I bought his NCLEX Success Workbook, which is simple, easy to understand, and very organized per system. I love his Thursday night Facebook Live for Prioritization Delegation. So we're doing this at this time every Tuesday. If you've been looking for a review material, this is super worth it. Also, Sir Alan is so hands-on and makes time to answer your questions or queries. Congratulations, Diane, for passing your NCLEX, one of our success stories, of course. Okay, and then also another announcement, everyone. We have our upcoming sale, April Fool's Day. So it's going to be only for 4 days, March 31 to April 3, 2022. 50% off as usual with our self-study comprehensive online NCLEX review course, 1 year unlimited online access NCLEX review. So if you're interested for a self-study program, then you can get a very good discount at this time. And also, we have a 30% off for the workbook. So instead of $99.50 for the workbook is only $69 at this time. So the workbook usually is $99.50. It's like 400 pages. That's something that you use when you review online. Okay, so that's our sale, everyone. Take note of that. March 31 to April 3, 2022. And remember, the code also is 50% RN and 50% PN for the PN to get your discount. So we'll be posting the link also for the enrollment in the chat box or in the comment section. Now, when you review with us, at this time we're providing, so this is only limited edition, okay? Limited edition only. We're sending out boxes together with our NCLEX workbook. So you will receive your NCLEX Dream Box, okay? It has everything. It has your calendar inside. It has your checklist, bookmark. It has different materials that comes with it. So that is our box. So you receive the workbook in a special box, everyone, and we send that via FedEx. So for those who have received my NCLEX Success Workbook and also the box, please share in the comment section your experience about opening, and it's an experience when you receive our product. Another one too, if you order the workbook, okay, if you order the workbook until April 3, 2022, you will also get our special pen. Our special pen, it's rose gold. It's really very nice, and it comes with a box. So this is only limited promo, everyone, only until April 3. It's our special pen that you can get, okay? And it writes very well and a little bit expensive, but it comes with the product. So grab that pen, guys. So it's also for free for everyone, okay? And then another one that we have, we're very happy that Joy is our student, and she sent us a photo when she received the box, and also of course the workbook. So guys, if you have received my workbook and also the box, send us a photo, and then we can share that over here to inspire your classmates, because reviewing for the NCLEX is not just really all about preparing, physically, but also mentally. You need to be inspired, and you need to find the right material, something that's really very easy to read. Okay, so that's one of the greatest principles of learning, to really find the right material. It's simple and easy to digest and highly organized. Okay, highly organized. And of course, thank you very much, Nicolo Hernandez, one of my students. He passed the NCLEX using my book. Thank you very much, Nicolo. Okay, and then another one, our student sent this photo studying for the NCLEX. So you can see the the workbook, and of course the online academy as well. Okay, all right. And of course, just a big shout out for our upcoming program. So our next live webinar will be on 10-day live webinar every Saturday. Will be on April 16. So that's going to be 2 weeks from now, to June 18, 2022. That will be every Saturday from 8 to 4:30 p.m. Pacific time. So that would be every Saturday. So 10-day live comprehensive NCLEX review webinar. So if you graduated years ago or retaking your NCLEX, and you feel that you need to master your content, or you want to review the basic concepts again, from infection control to maternity nursing, medical surgical nursing, all the recent updates about the NCLEX, then this is the class for you. So in 10 days, I promise you, this is a promise, I'm going to bring back all the nursing concepts that you need to pass your NCLEX. Okay, all the nursing concepts that you may have forgotten, in a way that's very easy to understand. Okay, all right. And also, after the review program, you have access to all of our online resources for 6 months after the review program. Okay, and you can always email me as well if you have any questions. And of course, for tonight, we have our we will pick a winner from the comment section um, to have a free access for 90 days online access NCLEX review, so you can experience our online academy. Okay, we have NCLEX quizzes with rationals, and our rationals also come with video explanations as well, and of course rationals for those examinations every after subject, and it also comes with a final assessment examination. And all of the videos that we have here in YouTube and Facebook for the prioritization delegation are all in the online academy. So go to the online academy also right now, and then you can also do the free trial, so you can experience our online academy, everyone. Okay, all right. And just a very special request to everyone, if you can share, or if you're watching in YouTube, you can subscribe, please. Okay, subscribe and share with your friends so that they will also benefit from this program. Okay, so can you please give or write a big shout out in the comments section, if you're ready for our first question for tonight. Without further ado, right? And then also please put your location so that I could give a shout out where you're coming from. It's always nice for me to find out where my students are coming from in this session, guys. Okay, we're international. We have students from around the world. We have from Nigeria, we have from South Africa, we have from Saudi Arabia. So put your locations, guys. I will be very happy to see where you are. So say yes if you're all ready, everyone. We're going to have our first question for tonight. So I have prepared some interesting questions for you on delegation and prioritization. And of course, for tonight, what we're going to do is to focus on one disease condition, which is going to be the focus of our discussion. This disease condition is very common in your NCLEX. Okay, so let's tackle some practice questions in this. So the first question, everyone, our first prioritization question will be the usual, wherein you have 4 clients that will be given in the question, and then you have to choose the priority. Okay, and always remember that your test plan specifies or really states that your management of care or coordination of care comprises a big percent of your NCLEX. Okay, a big percent. So some students say that when they took the NCLEX, they didn't have a lot of prioritization. Some of them said that they have more of delegation. So sometimes it's a hit or miss, but definitely a lot of students come back and say that when these questions came out in their examination, they're very happy because they realized that they were really having a good understanding of the prioritization delegation. Okay, so we have the first question, okay, for tonight is going to be prioritization. So the question is, the nurse cares for several children with respiratory illnesses in the pediatric unit. Which child needs priority intervention? A, the 18-month-old child with respiratory syncytial virus or RSV infection who complains of a headache and a sore throat. B, the 2-year-old child with cystic fibrosis who develops persistent cough with specks of blood in the phlegm. C, the 3-year-old child with phenylketonuria who has a musty odor in the breath, skin, and urine. Or D, the 4-year-old child who has not been sleeping very well due to middle ear infection. So let's repeat. The nurse cares for several children with respiratory illnesses in the pediatric unit. Which child needs priority intervention? A, the 18-month-old child with respiratory syncytial virus disease or infection who complains of a headache and a sore throat. B, the 2-year-old child with cystic fibrosis who develops persistent cough with specks of blood in the phlegm. C, the 3-year-old child with phenylketonuria who has musty odor in the breath, skin, and urine. And D, the 4-year-old child who has not been sleeping very well due to middle ear infection. Now, I would like to challenge you. Can you please put your rationale for your answer? Why is it not letter B? Why is it not like A? Why not C? Why D? So put your rationale, everyone, why you put the answer. Okay, and also why the other options are not the answers. And while I'm waiting for your rationals, everyone, I would like to, okay, shout out for Garcia Leanne. She's coming from Texas. We have Joem, which watching from Santa Ana, California. Kimberly Cruz watching from San Diego, California. And we also have from UAE, we have Maria Nilda Estabilio Dabu. So welcome here for tonight, guys. And also, I would like to find out, can you put in the comment section who's the first time to join the session for tonight? Okay, first time, and I'll give you a shout out. Welcome to the group. So let's see, everybody, what's your rationale for picking the answers for this? Why letter A, B, C, or D? So again, you have four patients or four clients in this condition. Okay, so why not A, why not B, why not C, or why not D? So let's see. The answer, everyone, is going to be the priority answer. Is very direct to the point. Okay, so no surprises here. The answer is going to be letter B. Very good. So that would be letter B, guys. So congratulations, most of you got the right answer. And shout out to Joem. It's your first time tonight. Okay, very good. Welcome here. And also Charis Iwad, first time also from England. So nice to see you here. So 2-year-old Y, because letter B, why? Why letter B? Because in cystic fibrosis, it's okay to have cough, but then if there's specks of blood in the phlegm and also it's persistent, then we consider that as maybe it indicates the presence of a complication. So that's why letter B is going to be the answer. Now for your letter A, the RSV, or the respiratory syncytial virus infection, there are complaints of a headache and a sore throat. Those are the expected signs and symptoms of RSV, and they don't necessarily indicate the presence of a complication for letter A. Letter C, your musty odor in the breath, skin, and urine, that's part of the complication of PKU. So one of these days we'll be discussing also PKU in this class. Now, letter D, the 4-year-old child who has not been sleeping very well due to middle ear infection, then that's more of a sleep problem, but not really an emergency right now. Letter B is the answer because number 1, you have blood in the phlegm. So some children with cystic fibrosis, they do have blood in the phlegm from time to time. However, in this situation, especially if it's persistent cough and then you have blood in the phlegm, that is something that we need to look at or to be reported. Now, the first question that we have for tonight is that what is cystic fibrosis? Now, in a nutshell, cystic fibrosis is an exocrine disorder characterized by the increased production of mucus in the body. Increased production of mucus. Okay, so the problem with having a lot of mucus, common sense is going to affect your respiratory system, and then also it will clog your pancreatic ducts. Okay, so it plugs your pancreatic ducts, and that can lead to malabsorption because you don't have enzymes in your small intestines to digest the nutrients. And that's the reason why also you have fats in the stool because of malabsorption. Okay, you have your fatty stool. Now, cystic fibrosis is a multi-system disease. It affects a lot of systems: your integumentary, your reproductive, your gastrointestinal, and your respiratory. But it really is a problem or a disease that focuses on respiratory and gastrointestinal problems. Okay, the symptoms of cystic fibrosis. A lot of these children, they can live up to probably like 30, 40, and 50, but some of them develop respiratory complications that may even need lung transplantation later on. Now, so in cystic fibrosis, we'll be discussing in the next slides also the transmission of this disease condition. Now, can someone indicate in the chat box or in the comment section what is the diagnostic test for cystic fibrosis? What is the number 1 diagnostic test, the most popular test for cystic fibrosis? Okay, so can you put that in the comment section, guys? All right. Okay, so let's have the next question. Okay, so again, cystic fibrosis is a condition characterized by increased production of mucus by the exocrine glands, and also causes blockage of your pancreatic ducts that leads to malabsorption. Okay? All right, so let's have the next question, everybody. Answer the question. So Kimberly said the diagnostic test for cystic fibrosis is sweat test. Very good. I have another question though. For the sweat test, of course, you're using pilocarpine to stimulate sweat production. My question for the sweat test is, what is the result that indicates the child is having cystic fibrosis? Okay. So sweat chloride, so okay, should be normal less than 40. So what's the magic number that the child is having cystic fibrosis? What is the magic number, everyone? Okay. So for cystic fibrosis, that would be a chloride concentration higher than 60 MEq is a positive test result, higher than 60 of chloride concentration. So let's go to number 2 question. A pregnant mother tells the nurse that she carries the trait for cystic fibrosis and asks if her children will get sick of the disease if the father does not carry the trait. The nurse should reply that A, all of their children will become asymptomatic carriers. B, there is a 50% chance that every child may develop the disease. C, none of their children will get sick of cystic fibrosis. Or D, only male children will be affected while females will become carriers. Again, I will read the question. This is all about cystic fibrosis transmission. A pregnant mother tells the nurse that she carries the trait for cystic fibrosis and asks if her children will get sick of the disease if the father does not carry the trait. The nurse should reply that A, all of their children will become asymptomatic carriers. B, there is a 50% chance that every child may develop the disease. C, none of their children will get sick of cystic fibrosis. And letter D, only male children will be affected while females will become carriers. Okay. So Nicolo Hernandez is from California. And also first time watching Kimberly Cruz. We also have Flo Quarteng. Hi, good evening. Okay. And then also we have Gina. Okay, also Papa Talk. Okay, and then we have Sai Leila also. So put your rationale for your answer, guys. Is it going to be A, B, C, or D? Okay, and I will explain more about your cystic fibrosis, everyone. Okay. All right. So what's the answer? So most of you, are those final answers? Let's see. The answer to this question, everyone, is one of the most difficult items that you will encounter in the NCLEX for pediatric nursing will be questions about genetic transmission of diseases. And there are different types of transmission of diseases, genetic transmission for pediatric conditions. We have the autosomal recessive, which is highly popular. You have your autosomal dominant, and then you also have your X-linked or sex-linked recessive trait. Now, for cystic fibrosis, what will be the chances? The question is, what will be the chances of having a sick child of cystic fibrosis if only the mother has the trait, the father does not have the trait? Okay, so only the mother carries the gene. So the answer to this question, everyone, is going to be, all right, the answer will be, okay, let's see who got the right answer for this question. The answer for this question, guys, is going to be letter C. None of the children will get sick of cystic fibrosis. None of the children will get cystic fibrosis. Can someone tell me in the comment section, what is the transmission of cystic fibrosis? What is the transmission or genetic transmission of this disease? The genetic transmission of cystic fibrosis, everyone, is, okay, is autosomal recessive. What is the meaning of autosomal recessive? Okay, I will slow down a little bit. It means that in order for a child to have the chance of getting the actual disease or getting sick of cystic fibrosis, autosomal recessive means that the child needs to get a copy of the defective gene, one from the mother and then one from the father. So meaning that both parents need to have the genetic trait or the defective trait in order for a chance to be sick of cystic fibrosis. Which means to say, if the mother has the trait and she marries someone with no trait, there's no chance of having the disease in the child. The highest possibility probably is getting the trait or being normal. Okay, so no children will get sick of cystic fibrosis. Okay, however, if the mother and the father have both the genes, then the defective genes, then there is a chance to have a child who is really sick of cystic fibrosis. So I hope that you understood that. Okay, now your letter B, a 50% child that the child may develop the disease, that's usually applicable for autosomal dominant. When you say autosomal dominant, not autosomal recessive, autosomal dominant, it means that even just one parent having the defective gene will be able to transmit the disease to the child, like an actual condition can happen. So you call that your autosomal dominant. So autosomal dominant is usually present, or usually, your Huntington's disease is an example of autosomal dominant transmission. Now, autosomal recessive, examples of that requiring from both parents to develop the disease, that will be your PKU, cystic fibrosis, and also sickle cell anemia. Those are conditions that are autosomal recessive. Your letter D there, which is the only male children will be affected, that applies to hemophilia. Hemophilia is an X-linked or sex-linked recessive disorder, which means to say that males are affected and the females are the ones who transmit the disease. Okay, I discuss further about this when we do our review program. I go deeper and really discuss the different transmissions and how to calculate the transmission, because in the NCLEX you will have situations like this wherein you have to kind of like be aware of the outcomes based on the status of the parents, if they have the trait or not. So again, just kind of like going back, your cystic fibrosis is an autosomal recessive disorder, which means to say that both parents or the child needs to have a copy of the gene from the mother and the father in order to develop the illness, okay, or the sickness. Okay, now let's go to the next question, everyone. That was a little bit challenging question, so I would encourage you to really kind of like go back and really review those concepts about genetic transmission. Now let's go to another concept. Okay, now number 3 question, everyone. Okay, so let's go to the signs and symptoms of cystic fibrosis. A 3-year-old child is admitted to the pediatric unit due to worsening symptoms of cystic fibrosis. Okay, now which signs and symptoms will the nurse expect? Select all that apply. A, salty tasting skin. B, cough with thick mucus. C, clubbing of the fingers. D, yellowish skin discoloration. E, visible peristaltic waves. And F, foul-smelling bulky greasy stools. A 3-year-old child is admitted to the pediatric unit due to worsening symptoms of cystic fibrosis. Which signs and symptoms will the nurse expect? Select all that apply. A, salty tasting skin. B, cough with thick mucus. C, clubbing of the fingers. D, yellowish discoloration of the skin. E, visible peristaltic waves. And F, foul-smelling bulky greasy stools. Okay, choose your answer, everyone. Okay. So the most common cause of death of children with cystic fibrosis is going to be a respiratory failure. Just remember that, respiratory failure. So just a quick shout out for Michael Ilagan, been watching Matus videos from session 1 to 14. She passed her NCLEX. Congratulations for that. So keep answering, everyone. Choose your answer. Okay. What are the signs and symptoms of cystic fibrosis? Select all that apply. Okay. What will be the answer? Let's see. So you have different choices. Okay. So shout out again. Ronald Limbago. Nenen Bags Limbago. Okay. Thank you for being here. Rich John Hanan Nicardo. Okay. For Dapia Tello also. Okay. Thanks for seeing you here. Okay. So hopefully you learned something about the transmission of cystic fibrosis. We have a question. How likely is it for a child to develop CF as an adult? Cystic fibrosis is usually discovered in childhood, okay, as early as 2 years old, but then they can develop into teenagers also and young adulthood too. But the challenge definitely will be the respiratory complications. So the answer to these questions, everyone, okay, the answer very quickly, everybody, is going to be, let's see, that would be, okay, let's see if you got the right one, guys. Somebody said, okay, let's see. Congratulations for those who answered A, B, C, and F. So that's the answer, guys. So you have your salty tasting skin, cough with thick mucus, clubbing of the fingers, and foul-smelling, bulky, greasy stools. The reason why you have salty tasting skin, that's really the number one for cystic fibrosis. That's how parents discover that the child has cystic fibrosis, because of the salty tasting skin. Okay, they excrete a lot of salt or sodium. So hyponatremia is one of the problems in cystic fibrosis, or low sodium, and that's why we give them pretzels, pretzels with salt, especially during summer, wherein they lose a lot of sodium. Cough with thick mucus, that's number one respiratory symptom. Clubbing of the fingers because of chronic hypoxia, so that will be included. So long term, these children can develop clubbing of the fingers because it's a compensatory mechanism due to the lack of oxygenation in peripheral circulation. Now your letter F, foul-smelling, bulky, greasy stools, you call that your steatorrhea. Steatorrhea is the fatty stool, pale, greasy, foul-smelling, and the reason for that is because of the lack of enzymes to digest nutrients in the small intestine because of the blockage. There's a lot more symptoms for cystic fibrosis. You have wheezing, you could have dyspnea. Sometimes long-term, they can develop also barrel chest. Okay, in newborns, if you're gonna be asking the NCLEX, in newborns, what's a common manifestation or finding that a newborn has cystic fibrosis? The answer is meconium ileus. Meconium ileus in the newborn is the earliest manifestation, or in the thick stool, causes the absence of bowel movement, okay, which can cause intestinal obstruction, of course. All right, so those are the common symptoms of your cystic fibrosis. I hope you learned something, everyone. Okay, all right, so let's remove that. So yeah, so Kimberly said she has to add salt to all of the food, even water as well. So clubbing of the fingers is of course included because of the long-term complication of respiratory obstruction. Okay, all right, now some boys or males may also develop sterility, and the reason for that is because cystic fibrosis also affects the reproductive system because of the changes in the consistency of the seminal fluid, and there's a reason why pregnancy or fertilization may be difficult. Now another one is going to be rectal prolapse as well, as the other signs and symptoms of the disease. Okay, so let's go to the next question, guys. Get ready. The nurse cares for a child with cystic fibrosis. Which interventions will be included? Now you know the signs and symptoms. Hopefully, you will have an idea of what are the major interventions for cystic fibrosis. Okay, select all that apply. A, monitor the stool pattern. B. Administer bronchodilators. C. Provide high-calorie, high-protein diet. D. Avoid red or purplish liquids. E. Perform chest physiotherapy. And F. Administer pancreatic enzymes. Okay, so again, the nurse cares for a child with cystic fibrosis. Which interventions will be included? Select all that apply. A. Monitor stool pattern. B. Administer bronchodilator. C. Provide high-calorie, high-protein diet. D. Avoid red or purplish liquids. E. Perform chest physiotherapy. And administer pancreatic enzymes. Okay. So Joy said that she's also Matus, so maybe we're relatives. So maybe we'll just have to find out. Maybe we're relatives, Joy. Then, so Leon Garcia says she's learning. Very good. Okay. So the diagnostic test for cystic fibrosis will be the sweat chloride test, definitely. And newborn screening may be done in some states and may consist of immunoreactive trypsinogen analysis. There's also a chest x-ray, your pulmonary function test, and your stool fat analysis. Okay, so we also need a stool sample. So those are kind of like additional diagnostic tests for cystic fibrosis. But the number one is going to be your quantitative sweat chloride test. Okay, so put your answers, everyone. And the question is, can children with cystic fibrosis develop failure to thrive or malnutrition? Yes, they can develop malnutrition and failure to thrive because of their inability to absorb nutrients. So let's go to the answer, everyone. Okay, let's see. The answer is going to be A, B, C, E, and F. Very good. Most of you got the right answer, guys. Congratulations. 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 Okay, some of you missed the letter F. Now, the reason is monitor the stool pattern because we all know that in cystic fibrosis, they have fatty stool. And one of the things you need to remember as well, guys, is you need to monitor the stool consistency and also monitor for intestinal obstruction, which could be a problem. And remember this in the NCLEX too. If they ask you what is one way to determine the effectiveness of enzymes that you're giving during meals, it's to monitor the stool pattern, okay? Because whatever enzyme you're giving, it should be reflected on the, the consistency of the stool. Your letter B, bronchodilators, you could give mucolytics as well. Anything respiratory, because the number one problem in cystic fibrosis is going to be the thick mucus. Okay. Then also you have your letter C, provide high-calorie, high-protein diet. It's very important because the child may be losing weight, or the child may be also having malnutrition or failure to thrive. So that's really very important. And also to provide salt, you can have pretzels as well. Okay, pretzels with salt. Now, letter E, perform chest physiotherapy. Now, what is chest physiotherapy? Chest physiotherapy is a procedure or treatment wherein the goal is to remove mucus from the chest. Okay, sometimes patients or children with cystic fibrosis have special devices or equipment that they put on their chest, and then it vibrates to remove the mucus. So, but normally when you say chest physiotherapy, also it involves percussion. You form a cup hand and then you strike the chest to remove the mucus, or you can also vibrate the chest as well. So that's your chest physiotherapy. You can also have your incentive spirometry to promote deep breathing and coughing as well. Now, letter F is one of the cornerstones of treatments for cystic fibrosis, the administration of pancreatic enzymes. For example, we have pancreolipase, pancrease. We administer that because we all know that in cystic fibrosis, there is a blockage of the pancreatic ducts that prevents the enzymes, your trypsin, amylase, and lipase, going into the small intestine. So that causes the malabsorption of nutrients, resulting into the fatty stool. Okay, now my question to you, everybody, is when is the best time to give your pancreatic enzymes? Can you put that in the comment section? When do we give pancreatic enzymes, everyone? Is it before meals, after meals, or with meals? Put that in the chat box, everybody. Okay, so I think we have discussed a lot of questions about, not really a lot of questions, but a lot of concepts about cystic fibrosis for tonight. So we give your pancreatic enzymes with meals or with snacks, definitely. Okay, but sometimes some material says before meals, you know, so that would be acceptable as well. But with meals seems to be the most common answer usually in NCLEX questions. Now, let's proceed to the last question for tonight, everyone, unfortunately. So the last question for tonight is going to be a delegation question. So let's see your answer for delegation, everybody. Okay? All right. Okay, so delegation question, everyone. The registered nurse or RN assigns a task, okay, to the licensed practical nurse and unlicensed assistive personnel while caring for a child admitted for exacerbation of cystic fibrosis symptoms. Which of the following tasks are appropriate to delegate to the LPN? Select all that apply. A. Perform nasopharyngeal suctioning. B. Ensure that there is an emesis basin at the bedside. C. Administer oral erythromycin antibiotic. D. Discuss the treatment and procedures to the family member. E. Assist the child in performing deep breathing and coughing. F. Review the discharge plan with the healthcare team. Okay, again, the registered nurse assigns tasks to the licensed practical nurse or LPN and a licensed assistive personnel or UAP while caring for a child admitted, okay, admitted for exacerbation of cystic fibrosis symptoms. Now, which of the following tasks are appropriate to delegate to the LPN? Okay, so A. Perform nasopharyngeal suctioning. B. Ensure that there is an emesis basin at the bedside. C. Administer oral erythromycin antibiotic. D. Discuss the treatment and procedures of the family member. E. Assist the child in performing deep breathing and coughing. And F. Review the discharge plan with the healthcare team. Okay? Okay. So let's see. Some of you answered A and B. Some of you answered A, C, and E. All right. So you have different responses. Okay. Okay. So some of you answered letter A and C. Just to kind of like remind you, you know, you are supposed to administer assign tasks to the UAP and the LPN based on their scope of practice. Okay, so Cordapia said B is for UAP, D is for RN, and F is for RN. Let me see if that's going to be the answer. Okay, so let's have the answer, everyone. Okay, so cross your fingers. All right, show and stream. Okay, so the answer is going to be for the LPN, you're going to have letter A, letter C, and then letter E. A, C, and E. So Noreen Pasaporte, you got that right. Congratulations. Kimberly Cruz, you also got that right. We also have Kumar. Very good, you got that right as well. And Emmeline Bruno Sales, also correct. So congratulations, we have a couple of people who got this right. Now, performing nasopharyngeal suctioning, that is within the scope of practice of the LPN. Okay, they can perform suctioning. Also, especially for international graduates, you need to be familiar with the functions of the LPN. Okay, now letter C, LPNs can give oral erythromycin antibiotic. The only exception for LPNs is that they cannot give IV antibiotics. They cannot give IV or intravenous drugs. Okay, now letter E, assist the child in performing deep breathing and coughing. Of course, that is included, is within the scope of practice of the LPN to assist. Okay, now let's discuss the other options. Now your letter B, this B says ensure that there is an emesis basin at the bedside. That is something that you can delegate to the unlicensed assistive personnel or the nursing assistant to provide an emesis basin at the bedside. Okay, so that is for the UAP. Your letter D, discuss the treatment and procedures to the family member. The word discuss, the word instruct, the word explain, especially when you're talking about treatment and procedures, during admission, that has to be done by the RN. So teaching, okay, that would be the RN. So remember, we discussed the very basic principle that RNs do not delegate teaching, assessment, planning, and evaluation. Assessment, especially for the RN, assessment means the complete and comprehensive and admission assessment. Your letter F, that is for the RN as well, because you're reviewing the discharge plan with the healthcare team is going to be the RN. Coordinating care, discussing this with the healthcare team, leading the meeting, that is the responsibility or the task of the registered nurse. Okay, being the leader and of course reviewing the discharge process with the healthcare team. So that's why letter F is for the RN, letter D is for the RN, letter B is the UAP. Now your LPN, the role is going to be A, C, and E. Okay, so hopefully you learned something tonight. Okay, so we always do delegation and prioritization here, so especially delegation. So I hope that by this point you already get the gist of it. Okay, so guys, before I end for tonight, I'm just gonna have to give a shout out to our program, of course. Okay, so our program, we have the Matus Nursing Review Online NCLEX Academy. So we have two choices. You can have your self-study program or you can join our live webinar every Saturday. So these are all the features of our program: interactive core content review, highly organized platform. We have the NCLEX Success Workbook, your checklist, your NCLEX quizzes after the topics. We do have the Facebook live recordings as well. So we have been so happy about the responses of students enrolled in our program. So thank you very much, guys. We keep on improving it. Now, another one, of course, I would like to share, everyone, I have good news for everybody. One of the things that happened recently is, as what I have said last week, I am now, or Matus Nursing Review is now a continuing education provider in California. So what I'll be doing is I'm very much open to invitations to do in-services, usually 1 hour in-services in skilled nursing facilities or in any setting. So I can do, or we have prepared courses for change of condition reporting, SBAR, customer service, pulse form, and of course, my most favorite one is the older adult sensitivity and empathy workshop. I really like doing the training, the senior sensitivity, which I call is the older adult sensitivity and empathy workshop. It's really a workshop on how to feel as an elderly or as a senior. What are the challenges, especially we are all healthcare workers. Okay, it's a very successful program that I have done before as well. Now, the program that we have in the online academy is both for RN and LPN, okay, together. Now, also what you have here is I have my shirt. It says I can do it. So If you want to have this shirt, you can go to our website also and get the shirt as well, everyone. Okay. And then, of course, finally, what we have is congratulations to last week. So for last week, we have Bernard Marziani. So she's the one who won the 90-day online NCLEX Academy. And so far, Bernard Marziani has not contacted us yet. So I would like you to contact us to claim your prize. So MJ, thank you very much for learning for tonight. Okay. And then Noreen Pasaporte also, thank you very much for staying. Okay, and Garcia Leon as well. So thank you very much, guys. And of course, spread the word to your friends, everyone. And of course, thank you very much, everybody. It's Tuesday, and be safe out there. And it's already April, everyone, in 2022. So thank you very much, everybody, and have a good night, guys.